access to abortions is already severely limited in parts of the country, with many women having to travel out of the state to have the procedure. And if Roe v. Wade is overturned, the impact crosses state lines and laws even more. Dr. Jessica Shepard is an OB-GYN and the Chief Medical Officer at Verywell Health. She joins us now to talk more about this. Good to see you, Doctor.
Good to see you too, Kira.
So let's break this all down and what it could mean, especially in the 13 states, including Texas, that have so-called trigger laws, the abortion bans designed to go into effect if Roe v. Wade is overturned.
Now, when we look at it historically, just looking exactly at what this law was made to do was looking at the legal decision of autonomy of a woman to make a decision based on her body and the decision that she makes with a healthcare provider. So even looking at that and what we said earlier, I saw in the earlier segment that taking away the right of an individual really hasn't been done before. So this is really going to have some negative feedback and negative outcomes.
So as an OB-GYN who practices in the great state of Texas, what is your experience like treating patients who may be considering abortion as an option? Who's more likely to consider abortion and why?
That's a great question, because I think the misinformation is that there's only a certain type of person who would consider an abortion. But when we actually look at abortion and the term and what it means, there's so many reasons why a woman might decide to get one, whether that it's just not financially, economically for her at that time, whether it's, a relationship that is not working, or whether it is, again, from any type of trauma such as incest or rape. There are multiple reasons why. However, that should not be the reason why we should look at why a woman would decide to do that. The ultimate decision is when she does decide to do that, that is where the healthcare portion comes in and the ability for her provider to provide that service for her because she has made that decision. And when we look at, again, the historic perspective of Roe versus Wade, it was really made in 1973, again, to legalize the procedure across the U.S. because prior to that, it was not legal. And so, again, this is looking at the right to privacy that's protected by the 14th Amendment of the Constitution.
So what are the potential dangers then, Dr. Shepard, that women could face when putting things into their own hands, if they're forced to do that, if the Supreme Court strikes down Roe versus Wade?
Now, this is looking at the ability to have a safe abortion versus an unsafe abortion, and also for providers who are very skilled in being able to do this procedure. Now, where is that ability for a woman to get the access that she needs and the resources that she needs if she does decide to have an abortion? Now, as it stands right now, abortion is legal in all 50 states, but look, we're talking about Roe versus Wade being overturned. What that would mean from a legal perspective and also from a medical access perspective. And so we know that that's going to impact a woman's economical, emotional, her physical outcomes. And what we're seeing now is that most of the states that have the trigger law and who would most likely ban abortions if this were overturned, that's where we're going to see most of the outcome that's going to be negative, and women having to travel to other states and, again, not having the access, or worst case scenario, getting to a gestational age in which abortion is not the way that you would need to do to terminate a pregnancy. And I think that there's a lot of personal implication with this, is because people feel very personal about this topic. However, when we think about abortion, this really is a woman's right, and it can happen to any woman, to any family. And that's why, again, it needs to be fought to what we can do as the best of our ability.
Dr. Jessica Shepard, thank you for your perspective and your time. Really appreciate it.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.